I'm going to talk to you about the way we treat hip pain. When people have hip pain, we have to distinguish what exactly it is they mean. Sometimes that's difficult to do for doctors and for lay people, but when they say hip pain, they may mean in the groin here, they might mean the side of the hip, they might mean the buttock area, they might mean here, and it could be a variety of places. Most of the time, hip pain is arising from the low back. The low back is notorious for radiating and referring pain in a distribution of the hip that can be a little misleading. If you have pain of the hip joint itself, typically your pain is going to be in the groin area. If it's elsewhere, say the side of the hip or the back of the hip, that's 9.5 times out of 10 it's coming from your low back. So we can figure that out. We'll assess the hip joint, find out if you have some hip-related problem that might need referral to an orthopedist, or if physical therapy will suffice for that. If it's arising from the low back, we typically treat low back-related hip pain with spinal decompression treatment. That is a treatment where we lay on a table, we secure you to the table slowly separates to get pressure off of the discs, nerves, and joints of the low back, and that will help alleviate and resolve the pain that is referred to the hip area. Sometimes it's treatment that proves diagnostic and tells you retrospectively what the source of the pain was. So we have to sort these things out a little bit to figure it out. Sometimes you can't get your answer from MRI imaging. The MRI imaging may show changes that aren't related to your hip pain. They may entirely explain your hip pain. So we can sort all that out, and if you have hip pain, we'd be happy to see you and help you here at Backstrong Clinic. Thank you.